COVID-19 brought with it many challenges that the world was not prepared for. One of those was the increased use of disposable masks and proper disposal of medical waste. The World Health Organization recently revealed that tens of thousands of extra medical waste from the response to the pandemic had put strain on waste management systems around the world. But what has the impact been like here at home?
I think it is a serious concern. I think when the world started to protect oneself, against the COVID pandemic, we also realized that there's also a lot of waste being generated. One of which being, our masks and a lot of the test kits. Some of the medical waste. In terms of household medical waste, in inverted commas, like I said, masks. Those we really need to take care of, because I think it's still for the foreseeable future we're not going to do away with masks and a lot of the other associated products that we trying to protect ourselves. For example, containers of sanitizers. So these plastic items, the masks, we really need to take care and come up with a solution in terms of managing and disposing those wastes. It is serious a concern, for us as a city of Johannesburg, especially at Pick It Up, where we are a waste management company. I think we're all guilty to an extent that we throw our mask in the dustbin. I think the best thing to do is that we must start the separation at source. So starting at home, we need to separate our plastics, our papers, our glass, and the masks. So when it comes to the landfill site, that we can treat them better.
At risk to this health hazard every day are waste pickers.
We get the mask that's thrown into the dustbin. We get it in the landfill. Always we are getting that. Because of me, I'm talking according to my side. Yeah, I tested COVID, and then I get an injection. So I don't know. Maybe sometimes I'm one of the people who affected that mask. Get into the landfill here. We don't know, or maybe sometimes government must tell the people that they mustn't throw the mask into the dustbin, because there is the people working in the landfill side.
That was really a great concern when COVID was starting, and it still is even right now, to say, how do we know of those households that have got positive cases, and how then do we deal with their waste stream as part of the general waste stream that we collect on a weekly basis. Remember, our teams are at the household on a daily basis, and there is cases almost in most of the households, especially at the beginning. And the issue was, how then do we segregate and make sure that the waste that is generated from the households with the positive cases is actually treated differently. We have encouraged our household to put the masks, especially if they had positive cases, in a plastic bag, and they seal it in a plastic bag before they can just dump it as is in our black bins, just to ensure that at least our workers are not exposed.
What are the solutions to this problem?
And I think as a long-term solution, we will be looking at a medical waste treatment center for the city of Johannesburg to be operated by Pick It Up, where we can then receive those household medical waste, such as a mask. Then we can process them more responsibly and also taking care of the environment. So I think, we need to, number one, stop littering. Number two, we need to stop illegal dumping. If there's anything that you see, please do report it. I think lastly, just be responsible, and let us separate our refuse at home.
It is of course a worrying factor, and with what you are saying now, that we may be in this state for quite some time. What it requires is for our environmental health practitioners and other colleagues on the ground, maybe to strengthen the issue of education to not only to industry but also to members of the public in terms of handling such and safe disposal as such. Although what you find to be key issues where their strict management will be in the health facilities, where such, when generated, will go straight into the healthcare risk waste and be treated as such together with the rest of the healthcare risk waste. The right way, it's a way that does not pose health risk to anybody that is gonna be getting any closer to that waste. And to start with, is that waste needs to be collected, and transported through the service providers that are approved or that are authorized to do that, because they have been seen to be having the capacity to store, collect, or transport in a safe manner. So this includes ensuring that from the time waste is generated in the health facility until such time that it's finally disposed, there is no exposure to any person that is not protected and that is not supposed to be handling that waste along the way.